So good morning everybody. Today we are going to deal with an important system in general pharmacology. Okay, so autonomic nervous system. Every slide here will fetch you at least 3 marks question. Okay, please be attentive. So you had already this introduction to autonomic nervous system. So what is this autonomic nervous system? Yes, auto means it is not voluntary. Am I right? Yes. So we have a separate nervous system which will work without our will. So the drugs today we are going to deal with will be the cholinergic system. Okay, within the cholinergic system we have the cholinomimetic drugs, anticholinesterases, and directly acting the esters. Okay, so muscarinic agonist based on the receptors M1, M2 till M5. Okay, we have this natural alkaloids muscarine, pilocarpine, and Irreversible. Okay, you can remember it as NAP, muscarine, Irreversible, and Pilocarpine. Yesterday in the class, some people were telling Pilocarpine as the anticholinesterases. No, you should not confuse with physostigmine and pyridostigmine. Okay, we have physostigmine, pyridostigmine, and also Pilocarpine. Pilocarpine is a naturally occurring ester. We have synthetic alkaloid, oxytocin. Then we have natural alkaloids which are acting on this nicotinic receptor, that is nicotine, and synthetic we have DMPP. So we have this indirectly acting drugs, cholinergic drugs, that is the anticholinesterases, which we will be dealing with in the next class. So this indirectly acting ones are the ones which will inhibit the action of this metabolizing enzyme, that is acetylcholinesterase. That enzyme activity will be inhibited by these drugs. So we have this tertiary amides, physostigmine, quaternary amides, that is neostigmine. Yes, Vaibhav and Vinay. Can you help me? Come. It's an opportunity to shine. Come. Come. You are worth also. Come. You are Vinay. Come. Come on. Come on, nothing will happen. I am not going to come fast. We have greatest time. Yes. You have not many times, both of you, write the differences between them. Participate yourself fast. So we have indirectly acting cholinergic drugs, that is anticholinesterases, that is rub the board. You have 1 minute, both of you should coordinate and complete it. So quaternary ammonium compounds we have neostigmine, pyridostigmine, ammonium, taprine, donepezil, galantamide, and rivastigmine. So these are having some uses, less commonly used. Okay, so neostigmine, physostigmine, most commonly used. Then we have donepezil, rivastigmine. These are having their role as a neurotropic drugs. Okay, you will be learning about them later. So irreversible anticholinesterases, we have this organophosphorus compounds. Okay, so ecotherapate. Then what gases we have? Sarin, Suman. Insecticides we have this parathion, malathion, and OMPA. And among them there is one carbaryl and propoxyl, which are classified in the carboplates. You will get a lot of time. We will repeat this. This will be repeated. Okay? So, what is the meaning of this direct action and indirect action? So, direct action, you will get a chance. We will repeat that slide. Okay? Direct action, that you can directly act on the receptor. You can see here acetylcholine from the nerve ending, it is acting on the receptor. Okay? So, indirect action, that is cholinesterase drug inhibitors, for example, they will enhance the action of this acetylcholine by, you can see those GDs are the drugs which are inhibiting this enzyme. They are going and blocking this enzyme. So the acetylcholine, which has action in seconds, now it will be converted to the action in hours. Legible, capitals, something you write, the last girl should be able to read. Last corner girl, stand. So, autonomic nervous system, it is just a division of the previous class. Okay. So, we have this central nervous system and peripheral nervous system, brain and spinal cord. In the peripheral nervous system, which is located outside, we have this autonomic and somatic nerves. So, peripheral nervous system, they receive stimuli from the CNS and initiate the responses. It may be the receptor activated, it may be some cardiac related. Okay, if the vasodilator is used, if there is some bleeding occurring. So, everywhere we have this receptors and chemoreceptors which can activate or trigger the various peripheral nervous system. So, if a question is asked from this ANS, this diagram will help you to understand or to better represent your understanding. Okay. So, this central nervous system and peripheral nervous system. Among the peripheral nervous system, we have the sensory and the motor division. So, in the motor division, we have somatic and visible, both in sensory and the motor divisions. We have both somatic and visible. Among this visible, in the motor division, we have this parasympathetic and the sympathetic division. Yes, very good. Something is left out. Come here and add. So, this autonomic system, again, this here you can, this is very important diagram. Why? Because you need to know which is cholinergic system, which is the sympathetic system. Okay, so sympathetic system, parasympathetic system, or the cholinergic system and the adrenergic system. This diagram will help you to understand. Okay, so the important point what you need to remember is among the sympathetic system and in the parasympathetic system, you can concentrate on the diagram here. Okay, so among the sympathetic and in the parasympathetic division, you can see acetylcholine is acting as a preganglionic neurotransmitter. Are you getting? So, adrenergic system is not concerned with cholinergic system, but the preganglionic fibers or the preganglionic stimulus for this adrenergic system is by the acetylcholine. Okay, so sometimes in the exams the common question will be where all this acetylcholine will act. So, where else this acetylcholine will be present other than this parasympathetic system? You need to be able to tell that all the preganglionic fibers and in the somatic nerve ending we have this acetylcholine. So, after that, once acetylcholine is stimulated, has been released, there will be postganglionic release of this adrenergic transmitters. Okay, maybe epinephrine, norepinephrine, all these things. But in case of parasympathetic system, we have acetylcholine at both the ends. Yes, thank you. See, okay. So this is one more diagram which will help you to understand. Is it very simple or very complicated? How do you remember this? So we will think that a dog is behind a boy and a snake is behind a girl. Okay? So what will happen now? How their mind will work? So there will be activation of the sympathetic nervous system. What will happen to the pupils? Okay? Whether it is a snake or a dog, we'll see it again, the pupils will dilate. Okay? Whether it is a big dog or a small dog, whether how long their teeth are. So our eyes will be dilated, maybe to run away or to see the target animal. Okay. So what happens to the salivation? Salivation will decrease. Okay. You need to run away from the scene. Then what happens to the respiration? It will increase because you will be frightened. Okay. There is activation of the sympathetic system. You will be frightened. There will be increased respiration. What happens to the heart rate? You need more energy to run away. What happens to the heart? It will pump more. Then constriction of the blood vessels. Yes, the blood vessels will pump away the blood to the peripheral limbs. Okay, so that you can act faster. Then inhibits the digestive process because there should be constriction of the sphincters, both the lower esophageal and the anal sphincters. Then inhibit the digestive process. Why? Because we need lower blood into the peripheral limbs where there is more need. Relaxation of the bladder vessels. That means you are inhibiting the maturation reflex. That inhibits the defecation. So with all this mechanism, you will be able to run away from the scene. So vice versa, we have the parasympathetic system. Today's system for understanding, that is the cholinergic system. Okay, the vice versa or the opposite effect of what is sympathetic is going to take place there. Okay, so parasympathetic system will be more active when the person is at rest. Okay, so you can see here constriction of people, increased salivation, and when you are taking food, these things may happen. Okay, decrease in the respiration rate, heart rate, blood vessels dilate. There will be more circulation towards the stomach, so that the digestive process can take place faster. So we are looking now to the synthesis of this acetylcholine and the inhibitors of this acetylcholine synthesis. The three drugs are there. Okay, here you can see hemicolium, racemicol, and botulinum. Okay, so first what happens? Acetylcholine is synthesized with the help of choline and acetylcholine under the influence of the enzyme CHAT, short term. Okay, that is choline acetyl transferase. With that, you are getting this acetylcholine as a byproduct. After this, acetylcholine is incorporated into the vesicle. You can see there the vesicle containing acetylcholine. Then acetylcholine will be released. It will be pushed out when there is appropriate stimulus. Okay, so once there is appropriate stimulus, this vesicle will be pushed towards the nerve ending where acetylcholine will be released. Okay, so this hemicolium is inhibiting the transfer of this choline. Okay, so hemicolium is inhibiting the transfer of this choline back to the synthesis. Then we have this racemicol. Racemicol is inhibiting the vesicular incorporation of this acetylcholine. Then we have this botulinum toxin, which will inhibit the release of this acetylcholine. So this is again preparation for you. We have in parasympathetic system nicotinic receptors and the NN and the NN receptors. So in nicotinic we have again NN nicotinic neuronal and the NN receptor. Okay, so M1, M2, M3 and M4, M5. Where M1 is present, CNS, gastric glands, then M2 in the heart, M3 in the smooth muscles and the exocrine gland. Okay, I have better guidance for this. So, anyone perfect with this? Anyone can come and write it on the board? Volunteers? So M1, CNS and gastric glands, you remember that is more important. M2, you remember heart, that is very important, where it can act and bring about the response. Then M3 in the exocrine glands, very important. M4, M5, most of them in the CNS. Not visible, okay? Just remember, the first column is M1, second column is M2, third column is M3. The first drug agonist at M1 receptors, we have oxytocin, and M2 receptor agonist is bethanechol, and the M3 receptor agonist is Bethanechol. So the antagonist will have their therapeutic use, that is the parasympathomimetic and trimethylethanaminium. They are used for decreasing the gastric acidity. Then repeatamide, less commonly used, cholininergic and diazepanacin. We are using them in the urinary symptoms like maybe urinary tract infection due to PTH. The person has some symptoms due to urgency, hesitancy, and increased frequency. We can go for these drugs. So you might have heard about this G protein coupled receptors. So receptors chapter is over for you. Yes? GPCR, G protein coupled receptor. Have you heard of this? Yes? So you might have heard also about this, the subsequent. What are the parts of this GPCR? GI, GO and GQ. Okay, so if the drug or the position of this acetyl receptor at various stages or various parts, they have different functions. So intracellular transducer at different sites has different action. If GI and this GO are stimulated, we have this release of cyclic AMP, which can cause hyperpolarization, cardiac stimulation, and antagonism of the smooth muscle relaxation. So if this other pathway, that is phospholipase pathway or the diastole-glycerol pathway, IgG pathway is there, then we will get depolarization, smooth muscle contraction and glandular secretions. So you need to remember M2 can be inhibitory, okay? M2 can be inhibitory at the glandular release. That's what we need to say here. So, what is this action? What is the action of acetylcholine on different organs? So, in the practical class, you might have heard about the action of acetylcholine on the eyes. What are the receptors present? We are now speaking about the M3 receptors, which are present on the. So, cholinergic system is acting on 3 C's. What are the 3 C's? Yes. Yes, sir. Second statement first. What are the 3 C's? Yes, Jansi Rani. Yes. What are the 3 C's? Don't remember? Cholinergic system acts on the circularly placed muscles of the pupil and it can cause constriction of the pupils. Okay, so constriction is nothing but here meiosis. So contractility of this, contraction of the ciliary muscles, then there will be aqueous humor outflow. So in case of glaucoma, there will be decreased aqueous flow, and if we are using this meiotic agent as a therapeutic drug there will be constriction of the pupil and the trabecular mesh release effect will be there. Thereby the aqueous flow will be increased. So cardiovascular system, we tell it as the vagomimetic action. Vagus, have you heard of it? Is it a cranial nerve? Which one? So vagus can release the acetylcholine. Okay. So vagus or the acetylcholine action it will be similar. Okay. So what will be the action of this vagus on the heart? It can cause bradycardia, preceded by tachycardia, then vasodilation, all vascular ducts including the pulmonary and the coronary, then lead to hypertension, reduced contraction, and there will be more time in the diastole. So the net effect will be negative chronotropic effect and negative inotropic effect. So contractility and the heart rate both are decreased. Okay. So negative chronotropic, negative inotropic effect. Coming to the GIT, we told the antagonist tilenthapine, pyranzapine at the M1 agonist at the M1 receptor are used as an antacid tablets to decrease the gastric acidity here. So it increases tone, amplitude, contraction, there will be increase in the secretion and motility. And for that we are using this pyranzapine and tilenthapine which are having therapeutic effect. The antagonists have the therapeutic effect here. So coming to the urinary bladder, we told that antagonist diethanasin which is having M3 receptor there, that is used for the therapeutic purpose in case of benign prostatic hypertrophy. So what will happen if there is cholinergic action? There can be negative effects, that is increased irreversible peristalsis and the contraction of the retrosal muscle which forms the base of the urinary bladder, that increase in the voiding pressure or this. So it will increase the urination frequency. Then respiratory system, yes, it can cause this bronchoconstriction and increase bronchial secretions. Okay, so the receptors are this M2 receptors and M3 receptors, both are acting here. So M2 receptors, bronchoconstriction, M3 increasing the bronchial secretions. And we are using drugs such as anticholinergic drugs such as nicotinic bromide, tiotropium bromide to antagonize this effect. Okay, and they can be used in the treatment of the bronchial asthma. So the cholinergic action is not beneficial to the person at times. Okay, it can cause this bronchoconstriction and bronchial increase in the bronchial secretion. So other effects are increase in the exocrine gland secretion. Okay, that is sweat, increase in the sweat, all these things will be there. So one assignment for you. What is the exceptional point about this increase in the secretion of sweat glands? So how will effects through CNS? What is the effect of this? Acetylcholine. So you might be remembering where this phyllostrictine is used. Where is phyllostrictine used? Alzheimer's disease. So this phyllostrictine is enhancing the action of acetylcholine, and this drug is used for the Alzheimer's disease. And this drug is, the continuous of this drug are kind of both of you. Last bench, 2 girls. The continuous of these two drugs are nowadays used for neurotropic effect. Okay, neurotropic are the drugs which can enhance the longevity of the person can be enhanced with these drugs. So among them, Rivastigmine is there. Okay, here in CNS we are having a complex stimulatory effect. So ataxia, tremors, and restlessness. Where the symptoms are seen? Parkinson's. Okay, so the enhancement of the acetylcholine action can also lead to this Parkinsonism-like effect. Restlessness, the tremors, and all these convulsions can also occur. Blood vessels, we told, there will be initial mark on the blood pressure and vasodilatation. So why this vasodilatation takes place? Because it can stimulate the endothelium and release the EDRF, that is the endothelium-derived relaxing factors, that is nitric oxide. So other effects, you already learned that. So there is presynaptic neurotransmitter regulation. This is more of a PG question. What is the homotropic and heterotropic receptor interaction? Okay, the receptors which is present other side of the action. Okay, so there are something called as autoreceptors and heteroreceptors. Okay, you expect the receptor to be acetylcholine there, but you may also get a noradrenaline receptor there or a non-epinephrine receptor there. Okay, so where you expect it, it is there. That will be the heteroreceptor. Autoreceptor is at the preganglionic site. There may be some receptors which are working. So I will be able to help you with this. Okay, here you can see we have the acetylcholine here and the acetylcholine receptor present here. Okay, that is the same receptors. Okay, but this acetylcholine receptor, if it is present somewhere here, okay, we can call it as autoreceptor. Okay, but if again here we have some non-epinephrine receptor, we call it as a heteroreceptor. Okay, you will be learning it. Just remember there is something called as autoreceptors and heteroreceptors. Just to sensitize you to those concepts. Okay, so then we have this acetylcholine. Okay, so whenever a question is given on acetylcholine, if it is the main question, you need to write this introduction and then shift over to the receptors where they are present and their organic effects. Okay, muscarinic effects. All these things you need to summarize. So acetylcholine, 2-hydroxy and trimethylethanaminium ammonium. Okay, then we need to remember it is a neurotransmitter of the parasympathetic system, and also you need to mention here it is the neurotransmitter of all the preganglionic sites. So why it cannot be used therapeutically? One answer you already know. What is that answer? It is very short acting or long acting? Ultra short acting, within seconds its metabolism will take place, maybe less than 1 minute. Okay, then other than that there is multiplicity of action. Okay, so the target organs are different. Some organs, even though there is no innervation, we have the receptors for their action. So because of this multiplicity action, we rarely use it. Once there is multiplicity of action, you cannot expect that some action can take place. Okay, there can be the other response which is not expected also. That's why we avoid that. Then rapid inactivation, that is one negative point, has both muscarinic and nicotinic effect. So we told that the effect on the organs, we summarized that it is the effect of muscarinic receptors. Okay. Why this is important? We will be learning it in the last slide, okay, where I will be showing what is its effect, acetylcholine's effect on the nicotinic receptors, how it will act as a blood pressure modulator, and by the muscarinic action, how it can modulate the action on this blood pressure. So coming to the drugs here, Bethanechol, okay, it is structurally related to acetylcholine, strong muscarinic action, and it can act on this GIT receptors and increase the tone. So clinical uses, we can use it for this atonic bladder, postpartum and postoperative non-obstructive urinary retention, we can use it. When there is retention, we can use this, whereas the antagonist, the diamine acid, we are using it for BPH. Side effects, all the effects what we saw in this diagram, in the initial diagram, what you saw, what reflexes which we avoid when fight and check, all this will be there. Okay, salivation, hypertension, nausea, diarrhea, bronchospasm, all these things will be there. It will be the same effect with most of the cholinergic. Okay, so organophosphorus compounds, acetylcholine, all the side effects will be similar. So has both muscarinic and nicotinic effect. Okay, then we are using this drug because of its high potency and both action on nicotinic receptor. We are less commonly using it. Okay, it can cause meiosis and decrease the intraocular pressure. We are less commonly using these drugs now, just for academic purpose. So pilocarpine, yes, this is the drug we are commonly using now for glaucoma. So pilocarpine, natural ester, mainly used in ophthalmology. It has muscarinic effect, which is the effect on M3 receptors. It is a drug of choice in emergency lowering of intraocular pressure. So the ophthalmic emergency condition will be the acute angle closure glaucoma, where you need surgeries involved. So